OPB Podcasts.
From the Gert Boyle studio, it's OPB Politics Now for Thursday, August 14th. Governor Tina Kotek's office released an analysis this week detailing how much money Oregon stands to lose because of the massive federal spending bill President Trump signed in July. And the answer is, it's a lot. The state could lose more than $15 billion it uses to pay for health care and food assistance programs and a whole lot more. But Republicans have a different take. It's not the big, beautiful bill that's going to hit Oregon's economy. It's the overtaxing of Oregonians that is hurting the working class. Even when we're talking numbers, we're still talking politics. Welcome to the podcast. I'm OPB Politics reporter Lauren Dake.
And I'm OPB Politics reporter Dirk VanderHart.
Dirk, before we dig into the politics, just remind us what we are talking about here. The so-called big, beautiful bill contained a lot of provisions. Can you give us a super quick rundown?
Yeah, I can try. This bill, H.R. 1, was appropriately, I think, dubbed this Republican mega bill because it does do a lot. That includes, extending the tax cuts that Trump passed in 2017. It exempted taxes on qualified tips and overtime pay through 2028. It reduced or eliminated a whole bunch of green energy tax credits. It spent a ton of money, really, toward immigration enforcement, building a border wall, those kinds of things. I don't think it serves our interests to go over it all. And to be frank, I don't understand the entire bill well enough to do that. But suffice it to say, the bill contains several provisions that are a huge worry for states like Oregon. They are going to slash money, as you noted, that pays for health care and food assistance for low-income people.
And what we got this week was really our first sense of how all this might impact the federal money Oregon relies on to carry out some pretty major programs. The biggest pot of money that is going away is Medicaid money. That's money that the state uses to pay for the Oregon health plan.
Yeah, and you mentioned up top, Lauren, the big top line overall of this analysis that the governor released is that Oregon's federal funding might be reduced by more than $15 billion over the course of the current 2-year budget, but also the next 2-year budget. So all three of those budgets together, more than $15 billion. By far, the biggest piece of that calculus is because of impacts of the bill to Medicaid. So Kotek's analysis says the state expects a more than $11 billion hit between now and 2031 because of these changes. And that's really for a whole slew of reasons. The Trump bill created new restrictions on who can receive Medicaid services, but also how much the federal government is willing to pay for some things, and also how states are able to fund their match money to help the state qualify for Medicaid. And we can get into that a little bit. But all of that is going to take a big toll on how Oregon offers health care to low-income residents. I think in the current 2-year budget, the impact is expected to be around $500 million, but that really ramps up in coming years as different pieces of this bill take effect.
Okay, you are throwing out some pretty big numbers there. Let's put it into context. Just how do those fit into the grand scheme of Oregon's overall budget?
Yeah, so the state relies on the federal government for about a third of its overall budget. So, for instance, the budget that just passed in June assumes around $44 billion in federal funding out of an overall budget of about $139 billion. So Kotek's analysis says federal cuts are, I guess, comparatively modest in this current budget, only around $1 billion. That would theoretically ramp up to nearly $6 billion in lost federal funding next budget and more than $8 billion the one after that. So kind of snowballs as we move forward.
Okay, did her analysis break this down in, real people terms? I mean, do we know how many people could lose their health insurance?
It is not entirely clear right now. So there are so many moving parts to this bill that the state hasn't really offered a single analysis for how many people are going to lose health care. One very key provision of H.R. 1, though, is this new work requirement. It says people need to work or volunteer at least 20 hours a week in order to qualify for health care. That is, if they are able-bodied adults. The Oregon Health Authority says between 100,000 and 200,000 people could lose health care because of that requirement alone. Obviously, a lot of people, but impacts could be greater than that. And one major flag the state and really others are raising is that people won't just cease, obviously, needing medical care because they don't have health care, right? And the fact they are not under the umbrella of the Oregon health plan may mean they are seeking care later in emergency settings when they are sicker. And there's not a mechanism like Medicaid to ensure providers are being paid to treat them. The state says that's going to harm providers. It's going to harm hospitals. Particularly, there's concerns it's going to harm rural hospitals that may be serving these sicker folks.
And presumably cost a lot more ultimately at the end.
Right. And Republicans would say they have I think it's like a $50 billion fund to sort of help offset some of those problems. What we heard in the analysis this week is that they don't think that money nationally is going to be nearly enough to satisfy the hole that's created.
Okay, let's talk about the mechanisms behind why the federal Medicaid money is going away. Congress limited the federal provider tax, which states have used for years. Oregon has relied on for a long time. Republicans nationally, at least, have called it a scam or a loophole. Okay, break that down for us and just walk us through some of the other changes.
Yeah, so to the extent you remember anything about this year's legislative session, I know it feels like a blur. You probably remember, Lauren, a vote relatively early on. It was considered a big vote, right, where lawmakers overwhelmingly approved the state to re-up the state's provider tax. And the provider tax is sort of a tricky mechanism Oregon and other states use. It basically tells healthcare providers, we're going to tax you, but we're going to use that money to pay into the Medicaid system, use it to leverage even more money from the feds that is then going to come back to Oregon, is going to be used in our Medicaid program to pay providers back. The sense is basically providers pay in and they get the money back in the form of Medicaid. But you're right. Cliff Bentz, the state's only Republican in Congress, calls this a shell game. Republicans are not huge fans of the mechanism. So the federal bill reduces how high provider taxes can be. Currently, the limit is 6%. Oregon has a 6% provider tax. The bill ratchets that down to 3.5% over the course of a number of years. So it's going to slash billions of dollars the state relies on for Medicaid just in that sense. The bill also reduces the money federal government is willing to pay for some services to the tune of billions of dollars. The analysis released this week says the outcome of all this is really going to be to destabilize the Oregon health plan, result in negative health outcomes for people around the state.
The bill also adds requirements that people get screened every 6 months to ensure that they qualify for these benefits. And I believe right now it's every 2 years.
Yeah.
So that is also expected to hit the state budget.
Yeah, and that's something different than what we're actually talking about, right? We have been talking about how federal funding is going to be reduced. There are also huge added administrative costs from pieces of this bill. I mean, the state has suggested it might have to hire hundreds of people to do those benefit redeterminations, which impacts the budget above and beyond any loss of federal funding. And, it is not just potentially higher administrative costs that could impact the state. Actually, because of the way the tax code works here, we stand to lose state money. So Oregon uses federal taxable income to determine how much people owe in state taxes, right? And as I mentioned, this bill increases tax cuts. It includes new tax cuts. That essentially means, we are told, that the federal taxable income that Oregon uses to determine state taxes will be lower. So actual state money we put into the general fund is expected to be down almost $1 billion this budget just because of the way the tax codes interact and all that. So that's yet another piece of this that has folks in the Capitol worried.
Okay. Along with the Medicaid dollars, it looks like there will also be major cuts to another big social safety net program, the Supplemental Nutrition Assistance Program, usually just called SNAP.
SNAP, and we used to call them food stamps, right? That's kind of the shorthand a lot of people still use. I mean, this is the area state officials say is going to be second most impacted by this bill. The analysis suggested Oregon would lose out on around $3 billion in federal money between now and 2031. That is for a bunch of reasons. As you can imagine, this is complex. But one is that the federal government it could require Oregon to pay up to 15% of the food assistance benefits it pays out. That's entirely new. Until now, the federal government has always paid 100% of benefits. So it's requiring states to take on some of that work. Oregon and other states are also going to have higher administrative costs under the bill. And once again, there are work requirements for people to receive SNAP. That's going to cut the number of people who qualify. That's going to result in less federal money.
These are very significant changes.
Yes.
I would also be remiss if I did not mention the effort to widen Interstate 5 through Portland's Rose Quarter, which is maybe also now in jeopardy after the passing of this bill.
Yeah. So, I mean, huge bill. There's a whole ton of things that were rescinded. And this Rose Quarter project, under the Biden administration, scored a huge coup when it won a $450 million grant from the federal government that was going to pay to cap the interstate in the Rose Quarter, build an entirely new neighborhood over the interstate, kind of stitch together this Albina neighborhood that had been torn apart when the interstate was created. So that was a big deal, and $450 million was going to be around a quarter of this huge $2 billion project. So under this bill, almost all of that $450 million has disappeared. And that creates even larger headwinds for the project that already was facing big questions about how it was going to be funded. You know, we didn't pass the transportation funding package in the session. That impacts the project. Now we've lost almost $500 million. That impacts the project. I mean, it is not a particularly favorable development for the Rose Quarter.
What was Governor Tina Kotek's reaction to this analysis?
She loved it. No, I mean, you know, she's not a big fan of this. No Democrat's a big fan of this. In releasing these figures this week, she accused Trump and congressional Republicans of betraying Americans. She said people are going to be less healthy, less well off. Like this is a real public policy failure. She has said she's going to work with lawmakers, others in Oregon to minimize the fallout on this, but you know, there is just no realistic possibility that the state is going to find $15 billion extra dollars in the coming years to backfill whatever these cuts are. And so the question becomes, how do they sort of figure out what is most important, what services need to be trimmed, what services need to be cut? I mean, there's just going to be some real tough decisions ahead, it seems.
Oregon has one Republican in Congress. That's Representative Cliff Bentz. Did you have a chance to speak to him or hear his thoughts on this?
I did not. So we asked Bentz's office for comment on these numbers. Didn't hear back, but it has been, I mean, this bill was signed in July 4th. Bentz has spoken about his support of this bill. He is the lone Republican in Oregon's delegation. He's the lone person in Oregon's delegation to vote for it. And, you know, he's essentially said he's a big fan of most of this. He thinks the tax cuts in the bill are going to be popular and beneficial to Oregonians. He really downplays the impact that cuts to healthcare and food assistance are going to have. His contention is that, you know, people, one, are abusing the system in some instances. He would say sometimes sitting there playing video games all day and receiving healthcare when they should be working. I think that is actually something he told Coin. He argues, you know, this is going to cut down on wasted federal money, ensure only people who really need these programs will be served. I think we're going to have to see whether his constituents agree with that reading. Bentz has the most Medicaid-intensive congressional district in the state. Plenty of people that have voted for him rely on these services. And, you know, a lot of these impacts are years out. They staggered it so that we won't really have hard and fast impacts from this for a while. But, you know, that's sort of the risk he's running.
Well, I know you heard from House Republican leader and maybe future gubernatorial candidate Christine Drazan. What does she have to say?
Yeah, I mean, nothing that you wouldn't expect from Drazan. They are extension. These comments are sort of an extension of what we have heard from her repeatedly. She says, you know, forget this federal bill that is really trying to curb federal spending, which we need to do. It's really Democrat policies that you Oregonians need to be worried about. I mean, she specifically referenced the fact that we are still talking about raising taxes for transportation. There is an August 29th special session. Once again, there's going to be potentially billions of dollars in taxes taken up there, at least billions of dollars over the course of a decade. That Republicans really don't like. They think Oregon is sort of wantonly spending its money and taxing its people when it should be just better prioritizing. So that is her contention. And she took a shot, as she often does, at Governor Tina Kotek, who she says is dodging accountability and trying to raise her taxes. And I think you can't take any communique from Drazan these days without considering the fact that she probably has her political future in mind. What that looks like, we don't know, right? She hasn't announced a second run for governor. If she figures out that maybe this year or next year is not very good for Republicans. She may opt to go to the Senate, but a lot of the noises she is making right now would be compatible with a run for governor. And so I think it's clear that we will be talking about some of this moving forward. Drazen's going to be talking about Democratic mismanagement if she launches that run. Democrats, both here and congressionally, are likely to make Medicaid a very big deal as we approach the 2026 elections.
You have given us a lot of information and a lot of numbers. You mentioned that a lot of this is going to roll out slowly and in future years, but Can you give us a kind of a breakdown what this will mean for Oregonians now? I mean, is there a way for Oregon to start offsetting some of these losses?
Yeah, so what we hear, I don't know fully, but when I've talked to leading Democrats, it is clear, one thing they are talking about is disconnecting Oregon's tax code from the federal government. That would at least give us the ability to dodge that almost $1 billion hit that is theorized for this current budget. But, that's not as simple. I mean, that sounds like a wonky vote, right? But what you are functionally doing there is raising Oregonians' taxes by $1 billion. It's a tax vote. That means it's a 3/5 supermajority vote. We have talked on this podcast plenty. Democrats have 3/5 supermajorities, but that wasn't enough to get a transportation bill across the finish line during the session. It's not quite as easy as Democrats voting in lockstep, and I'm guessing Republicans would look pretty unfavorably about that. So that could get tricky. But more broadly, Lauren, let's think about this. I've been covering the legislature since 2018, and in that time, almost universally, there has been sunny budget numbers. Revenues have always come in. Often they've come in over expectations. There was a small hit in COVID, but that even rebounded. So we've really been talking about expanding services by and large, or at least being good stewards and not slashing budgets. I think when you talk to lawmakers now and policymakers, there is a real sense that a more period of austerity could be coming. They are really worried about the budget decisions they're going to have to make in next year's short session and maybe sessions moving forward. So that it is a dynamic that I am not familiar with and have not worked in. Maybe you have. You've covered Oregon politics longer than I have. But I think we are just should prepare ourselves for a bit of a vibe shift in that regard.
Okay. Well, thank you, Dirk. Let's leave it there for today. Thanks for joining me. Yeah. This week's episode of OPB Politics Now was recorded in the Gert Boyle studio. It was produced by Andrew Thien. Our audio engineer is Nalene Silva. Our music comes from Audio Network. In these uncertain times, we are certain that you have questions about local politics. Maybe we can answer them. We would love to hear from you. Email us at opbpoliticsnow@opb.org. We will be back next week with more political news from across the Pacific Northwest. Until then, you can find all of OPB's reporting at opb.org. Thank you for your support, and thank you for listening.